Most important words in our Constitution are the first three. We the people. Written in a beautiful script, written in a font size so that you can see it from across the room, these set out the mission statement for our Constitution, for our vision of government. Not government of, by, and for the privileged and the powerful, but government of, by, and for the people, as President Lincoln so eloquently summarized. It is our responsibility as elected officials to look out for decisions that serve this mission of government of, by, and for the people. To fight in times of trouble for policies that provide a ladder of opportunity and a foundation for families to thrive. But at this very moment, a secret group of 13 senators are devising a health care plan with the intention of bringing it to this floor with no public debate, no committee meeting, no public notice. Just bring it to the floor, have a few hours of debate, and put it forward, even though it will affect millions of Americans. Probably will hurt millions of Americans. But the secret 13 want to craft this policy. And why in secret? Because they're plotting a plan that will hurt so many people. They don't want the public involved in the process. They don't want to hear from the citizens from rural America or urban America who are so concerned about the TrumpCare bill, the bill that will immediately destroy health care for 14 million Americans, the bill that will immediately undermine the solvency and success of our rural health care clinics and our rural hospitals, the bill that breaks every promise the president put forward on health care, breaks the promise that every person will be covered, breaks the promise that people with pre-existing conditions will get the same price as everyone else, breaks the promise that the policies will be even better, higher quality. Instead, it guts the essential benefits, breaks the promise that the insurance will be at a lower cost. In fact, for someone roughly 64 years of age, earning about $26,500, their health care bill would go from $140 a month to $1,200 a month, a sum that's clearly impossible to pay on an annual income of $26,500. That's why it's being done in secret, because it involves broken promise after broken promise, destroying health care in every town and hamlet across America. Well, that's quite a contrast to the way that Obamacare was forged. Obamacare had a year-long debate. It proceeded to be in committee markup, that means with amendments being offered, in the Health Committee for about 5 weeks with television cameras rolling. 150 Republican amendments accepted during that process. And then the Finance Committee had its turn, and it had a very long markup, and it had dozens and dozens, if not 100 or more, Republican amendments adopted. And the debate was all over the country. It was in the newspapers. It was in every forum. It was right there, square center, nothing hidden. But this is quite different. And the Majority Leader today has started the Rule 14 process, specifically intending to bypass those Senate committees and bring the TrumpCare bill to the Senate floor, completely bypassing government of, by, and for the people. This is unacceptable, and I think my colleagues know that it's unacceptable. But they're hoping to do it so quick and so fast that they'll have a minimum of criticism from across the country. There should be a maximum amount of criticism here on the floor of the Senate. Every senator who believes that this democracy, this democratic republic, is one in which we do the people's work, should see the light of day. The debate should see the light of day in the forging of the bill as well as the final debate here on the floor. Now, we know another reason this bill is being crafted in secret. This replacement or addition or modification of the House bill And that's because the very premise of it is to give a massive tax break to the wealthiest American. Another promise broken, and Trump said that this would not be done. But there it is, TrumpCare out of the House, $600 billion given away to the richest Americans, while devastating health care for working Americans. Has no one noticed that we have an incredible gap in income in this country, with massive numbers of people earning very little and the few at the top earning massive amounts? Has no one noticed that we have a huge wealth gap in this nation, with those at the bottom having few, if any, savings, and those at the top having billions upon billions? Well, if you've noticed, then you should care that that is not a foundation for families to thrive. And indeed, it is something that is only made much worse in a bill that takes away the foundation of health care, essentially the quality of life of families across America, and in turn takes the savings and gives it to the wealthiest families. Well, there's a reason to hide this bill. There's a lot of reasons to hide this bill. But it's undemocratic to have this secret group developing this bill with an intention to bring it to the floor without a committee hearing, without public exposure. I'll tell you, folks back home are very worried, and I'd like to share a few of their stories. Linda of Talent, Oregon. Linda, who survived her battle with stomach cancer thanks to the Affordable Care Act's Medicaid expansion. Linda's friend wrote to share her story. Linda is a self-employed plumber working hard to get her business off the ground, but she was diagnosed with stage 4 stomach cancer. But Linda couldn't afford insurance, and she and her husband couldn't afford to pay for treatment out of pocket because they were paying off enormous debt from care that her husband had received. So what did Linda do? She ignored the symptoms. She tried to go about her life as best as she could. As her friend wrote, quote, she would have died rather than take on more debt that she was not confident she could pay. But that changed with the Affordable Care Act. And the day that Linda found out she would receive coverage under the Oregon Health Plan, Oregon's Medicaid expansion. Now, there's good news to share. Linda received treatment. She's been cancer-free for almost a year, and her friend describes this as nothing short of a miracle. Obamacare, the Affordable Care Act, it delivered a miracle to an individual who was planning to just die rather than get treatment, and then could get treatment thanks to the Medicaid expansion and is now in remission. But TrumpCare, being reworked in secret by 13 of my colleagues out of public sight, wants to strip away that expansion of Medicaid, wants to rip away the chance for people like Linda to receive life-saving care. Yvonne from Elmira, Oregon, sent a note to us about the high-risk pools that Republicans want to institute under TrumpCare. She says, before the ACA existed, I was in our state's high-risk pool because no company would insure me because I had asthma, and I had an ovary removed because of cysts. She says the $1,500 deductible and $550 per month premium was hard to pay, and it only covered 70%. And when I was severely injured in an accident and required reconstructive surgery, I ended up bankrupt. But then, 2 years ago, she qualified for the Oregon Health Plan. Now, Yvonne has her medical needs covered at an affordable price and can't be denied coverage or charged a higher premium because of pre-existing conditions. Yvonne, like so many others, would suffer on the Republican plan to strip away the protection for pre-existing conditions. She's had an accident. She's had an ovary removed. She's had asthma. It would be extraordinarily difficult for her to get insurance without the protection of everyone being in the same health care pool together. If she could get insurance, which is not at all clear, be at sky-high, unaffordable prices. Bernard from Portland writes to us. He says that an important thing that often gets lost in this whole debate over the future of the Affordable Care Act is the support it gives for Americans to innovate. In 2011, Bernard in Portland chose to leave his job and pursue his passion of becoming a freelance artist. Here's what he says in his words. With my departure, I left behind the security of medical coverage. For 2 years, I was not covered by medical insurance, and fortunately, nothing happened. But that's a gamble that no one should have to take. And he continues, it's a gamble that I could take being under 40 years old and in relatively good health. And he continues, a person should not have to stay in a job they may not like and could be better filled by someone else for fear of not having medical coverage. And he's right. One of the powerful things that has occurred under Obamacare is that individuals who worked for firms and wanted to become an entrepreneur were afraid to do so because of the loss of health care coverage. But now, either through the expansion of Medicaid or through the exchanges, they can acquire insurance without being part of a large company. And that has unleashed entrepreneurship across the country. People are pursuing their dreams and contributing to the economy in all kinds of ways because they can now access health care without being part of a company that provides health care. Eventually, Bernard was able to afford a basic coverage plan, but it didn't provide much, and it cost a significant portion of his income. But it all changed with the ACA. An October 2016 survey of American small businesses and a January 2017 follow-up survey found that 1/3 of 5,400 small business owners interviewed had the confidence to start their own businesses because they had access to health care through the ACA. According to the Department of Labor, between 2013, when the ACA went into effect, and the end of 2015, the number of self-employed Americans increased by 3.5%. These are just different ways of noting what we hear about all the time, of people launching their entrepreneurial efforts, launching their company, because of the confidence they have they can get health care. That's a powerful unleashing of creativity. It's an economic engine. It's a small business driver. Lisa from Phoenix also wrote to share her powerful story. Lisa's daughter suffers from cerebral palsy and epilepsy. So Lisa has stayed home and cared for her for the last 15 years while her husband worked. Now, thanks to ACA's Medicaid expansion, her family has been able to hire in-home help, and it's been transformative for their daughter's life. Lisa's daughter has become more connected to the community, gained new skills and independence, is contributing to household chores, and has shown a great deal more vitality and engagement since the family was able to get some assistance. It has gotten to the point where Lisa can start thinking about her own needs a bit more. In fact, for the first time in quite a while, she's considering taking a job outside her home to help provide more income. So the ACA isn't just saving lives in emergency health situations or by addressing diseases, it's improving the quality of life for millions of American families like Lisa's. I want to share just one more constituent story today. It's hard to pick just one more because there are so many stories coming in to me each and every day. So as we continue to talk about this assault on the health and peace of mind of millions of Americans, I'll be coming back down here to the floor to share those stories coming in from other Oregonians. But this last story comes from Warren in Tigard, Oregon. Warren and his wife, Joyce, have been happily married for over 60 years. But in the last few years, Joyce has been suffering from Alzheimer's. Joyce's disease has progressed very far. Among other things, she's lost her mobility, much of her cognition. She's wheelchair bound. And her condition progressed so far that Warren and the home caregivers, that were helping him care for his wife just couldn't meet the need requirements any longer. So they admitted Joyce to a nearby adult care facility where she is now secure, stable, and comfortable. But as we know, the kind of care Joyce is receiving is expensive. Warren writes, I quote, "This care costs $4,000 per month. Our long-term care insurance is currently covering most of this, but only about 4 months' worth of insurance coverage remains. So we will have to obtain Medicaid coverage for her continued care." He continues, "But proposed changes to the Affordable Care Act could jeopardize this coverage. I have not anticipated this disastrous change, but fear it would be a tragedy for both of us." Yes, it would be a tragedy for Warren and for Joyce to have TrumpCare pass and dismantle Medicaid and dismantle the exchanges. Be a tragedy for so many of others in similar situations across the country. What many people don't realize is that Medicaid helps pay for nursing home care with more than half of the nursing home residents like Joyce. But here's TrumpCare planning to cut $880 billion in direct Medicaid spending. It's basically, well, too bad, Warren, and too bad, Joyce. We want to save some money so we can give big tax breaks to the wealthiest Americans. I must say, there's not a lot of caring in that perspective. It embodies a principle, but is it really the principle that we want in the United States of America? The principle that the goal of the majority party is to take away from those who have little to give more to those who have most? Is that really the principle my Republican colleagues want to embrace here on the floor of the Senate? Is that really the principle that the Secret 13, with their secret meetings out of public sight to develop a new version of TrumpCare, want to embrace? I would suggest that that is simply wrong. It's wrong from the point of view of providing an opportunity for all Americans to thrive. It's wrong from a moral point of view to pull health care and the peace of mind that comes with health care out of the hands of struggling Americans and working Americans across our country. I finally want to address one more issue. We heard earlier today that Anthem is pulling out of Ohio. And why are they pulling out? Because of President Trump. Why is that connected? Because he refuses to confirm that his administration will make the cost-sharing reduction payments that have been part of the ACA, the Affordable Care Act. Those payments reduce the premiums. Those payments proceed also to reduce the level of deductibles so that you get more care sooner. And so insurance companies don't know whether to raise their insurance policies a little or a tremendous amount, and that instability means they simply can't price their policies. In addition, my Republican colleagues have assaulted the risk corridors or reinsurance programs that makes it possible for an insurance company to go into a new market and know that if they get a disproportionate share of sick patients, they will get compensated for that risk and that result. So that reinsurance is essential for more companies to be in a particular market. Moreover, the administration proceeded to not spend the money on advertising in the last stage of signups and reduce the number of people who were in the markets. So another assault on the stability of health insurance in America. This is a deliberate, straight-out effort to undermine health care in America to the disadvantage of millions of Americans. It's being done by the president without any action even happening on TrumpCare here in the Senate. It's wrong, it's hurting a lot of people, and the president should stop. And with that, I conclude my comments.